enough water? Sudah ada cukup? Cukup untuk sekarang? Okay. We had a wonderful opportunity this morning as we were driving. In it, we were made to realize how beautiful God's creation is. Let's also think of another part of God's beautiful creation today, flowers. Certainly not all flowers are the same, but to us, most flowers are very beautiful because they are creations from our God. I want us to think for a moment that God has created us somewhat like flowers. And as flowers or as beautiful women, we want to take care of ourselves. It's a good reminder for all of us as women to be reminded of who we are in Jesus. Sometimes we forget how beautiful we are in Christ. It's too easy to be thinking that we're not beautiful. We need to be reminded of who we are in Jesus. Women are beautiful wherever they are. Women work hard in these villages. Women sometimes are treated as second-class citizens in different places around the world. They aren't given the rights to speak up. They aren't given rights like men are in different places, or rights like we are in our country. So we want them to know that they are beautiful. Coming to a village, I see people who want to make a difference for themselves, for their lives, for their children. They want to educate their children. They want to be healthy. They want to grow. They want to earn money. They want to have a future. Generally, the kind of work that they do, they're subsistence farmers, which means that they basically just grow enough food for themselves and for their family. Maybe they grow a little bit extra to sell at the market, and that's maybe where they make some of their money. What I've noticed is that in order for a woman to get something, they will have to ask for money from a man because they themselves don't hold on to the money in the family. If they want to purchase something for themselves, like for example, the Softex or the pad that they use for their menstrual cycle, they'll have to go to the father or the husband and have to ask for that money. Access to purchasing menstrual pads for girls is something very difficult, especially in very remote areas.
When I interview mostly girls and women in remote area, in 1 year they have to spend about 120,000 rupees to buy menstrual pad, and it's so expensive for them.
Women will wear them for longer periods of time, and so hygiene is an issue for women as well.
Sometimes when they get menstrual, they go to school and then they change their pad when they back home. It's about 8 hours. It's a problem because infection can happen if we don't take care.
Sometimes they will wash them and then re-wear them, or sometimes women will wear towels or use some sort of material, again, which is not very hygienic for them. And then girls are not always very comfortable going to school because, of course, then you're always worried about leaking or making a mess, and then you're uncomfortable, you're nervous about getting up in front of your classmates.
Sometimes maybe they don't understand about the problem that can happen.
Education all around menstruation is something that's drastically needed for young people, because sometimes girls here think that when they get their periods, it's automatically time for me to start having a family.
It's a big problem because I met girls in the 14 or 18 years old and get pregnant.
Well, this is the time because I can start having a family. Now maybe it's time for me not to go to school.
They have to thinking about their future, what they want to be, like want to be teacher, want to be doctor.
So that's one of the reasons why we were requested to do a health project like this. Here we go.
The more fullest village that we visit, I don't think people from the health office want to go there to give health education. But Kingdom workers help us to go there and to give health education.
Jauh dari akses baik itu pengetahuan maupun akses air bersih. Jadi sangat penting untuk bagaimana menjaga kesehatan.
We're educating people about ways to keep their bodies healthier. So we work together with some nurses from a local hospital, and they come with me, and they are amazing. They volunteer with me.
I just think about, God, someday I want to give something for people in the remote area. And the dream come true. Yeah, Kingdom workers come and make my dream come true.
We arrive at a local church. We invite people from the church as well as the outward community, because we want to speak to as many people as possible to share the knowledge. And then when we get there, we usually begin with a devotion. And in that devotion, we remind women that they are beautiful in God's eyes, but that beauty is not something that's just on the outside. That's a beauty that we desire on the inside, a beauty that only comes from God.
We make them realize that we are God's amazing creation and we have to take care of our body to glorify God.
Hari ini kita belajar tentang sistem reproduksi atau kesehatan perempuan. Berapa liter darah yang keluar dari tubuh seorang perempuan sepanjang kehidupannya sampai setelah dia haid pada saat remaja sampai dia tua lagi pada saat sudah tidak dapat haid lagi.
Pubertas itu adalah satu masa paling penting dalam hidup wanita, di mana wanita maupun laki-laki, di mana semua hal itu bisa berubah. Ya, dan itu adalah satu masa yang paling penting. Kira-kira apa yang berubah? Banyak hal. Terus mulai ada rasa suka. Aduh, itu nyong pengganteng lah, itu siapa pun pacar tuh, itu siapa pun tulang rusuk nih. Nah, biasa begitu, toh ini dua pasti sudah ya. Oke ya, jadi sudah ada rasa. Kak Santi tahu, nah dulu Kak Santi sebelum belajar ini pun seperti itu, tapi setelah belajar ini jadi tahu. Ya, makanya
sebenarnya menstruasi atau haid itu adalah hal yang alami terjadi dalam tubuh seorang perempuan. Tanda bahwa seorang perempuan itu sudah dapat mens atau sudah dapat haid, berarti seorang perempuan itu dikatakan sehat. Kenapa dikatakan sehat?
Things wouldn't happen in the way that they do if other things wouldn't happen. So one thing has paved the way very nicely for another. So our work here started out with water. Water was the thing that brought us here. It was the most crucial thing that we were working toward. People didn't have clean water in their villages, water to drink, water with which to cook, water to bathe. So this last year, we were exploring what might be the biggest need for this year now. What was recommended by my people was for menstrual health. They really saw a need for young girls, young women, women of all ages really, to learn about their bodies, about how to take care of themselves, about reproductive health too.
Yang menarik bahwa hari ini yang pertama kami bisa dapat materi. Setahu kami bahwa kami tidak tahu menstruasi itu yang bagaimana, asalnya dari mana.
Education as far as health is very lacking. There are not very many health facilities. The distance that people have to travel often to a local clinic can prevent them from going to the clinic. But it's not just the distance. Sometimes it's a lack of knowledge. People don't have an awareness of when to go to the clinic. So what we're trying to help them do is to have a knowledge of when to go to the clinic. We even invite health professionals to come to our health workshops to encourage that relationship between the local clinics, the local hospitals, so that when we leave, maybe perhaps those people will end up going to the clinics to if they need further health care. One of the things that we address is a bit of sexual education too. We talk about when is a good time to get married, when is a good time to also have children, that maybe you should think about finishing school before you get married.
Yang terjadi hari ini sangat senang untuk masyarakat semua di sini, terutama jemaat ini. Dan juga menurut saya program ini sangat bagus sekali. Mungkin menurut saya ini sesuatu yang baru untuk ibu-ibu di sini.
Itu bahkan tidak ada yang tahu apa itu bentuk rahim itu seperti apa, itu bentuk kandungan itu seperti apa, mereka tidak tahu. Jadi dengan adanya program ini, mereka bisa tahu apa sebenarnya organ-organ apa yang ada di dalam tubuh kita dan bagaimana cara kerja dari organ-organ tersebut dan bagaimana cara mereka menjaga.
And then at the end of that, we introduced to them a product which is a reusable menstrual pad.
Nah, ini adalah satu solusi yang baru, pembalut sehat namanya, yang dibawa oleh Miss Coral dari Amerika, ya, ini dari Days for Girls. Ya, jadi ini adalah pembalut sehat yang sekarang pun Kak Santi sudah mulai pakai, Kak Yesti sudah mulai pakai, kami semua yang ikut dalam Kingdom Workers sekarang sudah mulai pakai ini. Ya, jadi ini adalah pembalut. Cuma lihat, pembalut apa seperti itu? Kenapa warnanya lucu sekali ya, tasnya manik-manik begini ya? Siapa yang tahu di dalam isinya adalah pembalut ya, bahkan pakai pipesta nih bisa nih, manik-manik ya. Iya, bawa pipesta ya, mengkilat-mengkilat seperti ini. Pasti orang suka ya, orang lihat, aduh itu tas beli di mana? Beli di Amerika ya. They feel so excited because it is very safely for our environment. You can use it and then you can wash it and use it again.
Dan bisa dibawa kemana saja. Misalnya untuk remaja yang ke sekolah bisa dibawa ke sekolah,
Ke ladang, ke sekolah, ke gereja, di mana saja kita pergi. Itu yang menarik, Ibu.
Ini sama kayak pembalut yang ada sayap tuh, dia ada begini kan, ada ini, terus dipakai, bisa dibalik sana dalamnya, terus ditaruh seperti ini, sama seperti pakai pembalut, ditaruh seperti ini, terus dikasih rekat, kasih lipat, dikancing ya. Posisinya seperti, terus dalamnya seperti ini, tinggal dipakai sama seperti biasa. Bisa?
It's an amazing product and it's made specifically for women, by women.
It's so good for us, and also because I say us because I use the same pad, and it's so good for all people around the villages that learn about the pad and they're very excited about the pad.
The material is made of flannel, it's very durable. It's a product that can last anywhere between 3 to 4 years before having to be replaced if a woman treats it well or takes care of it well. And then we give them an opportunity, if they desire to want to use that, we distribute that pad to them.
Kalau kami masih pakai protes itu Ibu, kalau selesai menstruasi itu kadang gatal, tapi sekarang DFG jadi tidak lagi. Kami rasa aman Ibu karena itu kami jalan di sekolah juga tidak ragu-ragu Ibu untuk tembus. Kalau protes ini kadang tembus Ibu. Jadi jalan di sekolah juga ragu-ragu Ibu. Kami minta terima kasih karena kami dapat DFG lebih baik.
It's something that they can be proud to have. It offers dignity to a young girl or to a young woman, a woman of any age, and not feel ashamed that they're having their period. Who doesn't want to feel beautiful, especially when you're menstruating? You know, it's a tough time for women, and it's a natural process for women. And instead of looking down on it, we should celebrate it because this is something God gave to all of us. Knowledge is the key. Knowledge is power. If people have that knowledge, they can make choices.
We can't give them health education. They don't have good education as we get at the city.
I mean, we could come and offer loads of medicine, we could come and offer loads of items, whatever. Those would be gone within a matter of time. But knowledge is something people can take away with them and have for a lifetime. And so that's incredibly important. Nobody can take that away from them. That's something that can grow.
Our responsibility is just to give them health education, and God will do more than it.
Most of our health projects that we do, our intended audience is pretty much everyone in the village. This one focuses on women usually from age 12 up. And so we might think that actually the only ones being blessed by a project like this are the women who are actually attending the program. But I think it actually goes beyond that. I think the people who are being blessed by this are actually everyone. Because a woman who is comfortable, a woman who is healthy, a young woman who is confident is going to be a blessing to her entire community.
Ilmu yang mereka dapatkan juga mereka bisa membagikannya kepada orang lain, kepada masyarakat yang terdekat dengan mereka, agar mereka juga bisa tahu apa yang sudah mereka.
They need to know that they're special. They need to know that they are incredible, because they are. We need them. They're a valuable part of our communities. And sometimes I think maybe they don't always feel like that.
I really hope that God also will keep them healthy, and their faith will grow every day. Yeah, like me.
When I first came here, when I asked a child, what do you want to be when you grow up? And they looked at me like I was asking a question that had absolutely no meaning to them. And now when I ask that question, there are some possibilities. Children are now having an idea about what they want to be when they grow up, because they see role models, they see that they have potential.
Thinking about the forest village and the bad road, it's very difficult to come. But when we pray for it and we work hard for it, God will help us to do that. Working with Kingdom Workers, I see that God works through everything to make everything that impossible, make it possible. Yeah.